Hey there, here's another practice question for you. This is on follows Maslow's hierarchy of needs. When you're answering test questions, you should be thinking about Maslow's hierarchy of needs, also the nursing process, and of course, ABCs. Maslow's hierarchy of needs is the basic physiological needs come first. Those are the priority. Then safety and security, love and belonging, self esteem, and self actualization. Okay, those are the order of priority. When you're answering questions, think of the physiological needs should always take priority over those other needs. Safety would come next, love and belonging, self esteem, and self actualization in that order. So, when you're looking at test questions, consider all the answer choices and go from there. Start with physiological needs, always the priority. Okay, so here's a sample question following Maslow's hierarchy of needs. The nurse has developed a plan of care for a client diagnosed with anorexia nervosa. So I did a lecture on anorexia. You can see that in my YouTube channel, Nursing with Hart, PhD. I did a I did a lecture on eating disorders, and I also did some other practice questions on eating disorder. And anorexia nervosa is one of the eating disorders that I covered. The priority. So here you're going to figure out which client problem would the nurse select as the priority in the plan of care. Okay, for the client with anorexia nervosa. Number one, malnutrition. Two, inability to cope. Three, concern about body appearance. And four, lack of knowledge about nutrition. Okay, and I'll give you a second to think about this, and then we'll come back with the answer and the rationales why the other answer choices are not correct. Okay, so let's come back to this one. The question is asking the nurse has developed a plan of care for the client diagnosed with anorexia nervosa. So you're going to pick out which one of these answer choices is the priority in the plan of care. And the correct answer is number one, malnutrition, because malnutrition is a physiological need out of the other answer choices. In the anorexia nervosa, this is a patient who is refusing to eat, doesn't want to eat, is obsessed with their weight, does not want to gain weight, has a great fear of gaining weight. This is a person who is eating much less than they should be, so their weight is way, way under what it should be. And there can be serious physical problems with that if that patient doesn't get some help. The other answer choices, let's look at those. Number two, inability to cope. So that's a coping strategy, okay, and that's not a physiological need. Number three, concerns about body appearance is important, and that's something that will be addressed in therapy later on after the nutrition issue is addressed. And then four, lack of knowledge about nutrition. That's patient education that will also occur at some point after physiological needs are met. Okay, and so that's that test question. Keep an eye on more. Keep an eye out for more of these, and try to remember Maslow's, and then the nursing process. I'm going to do another test question, practice question on the nursing process and how to follow that. Okay, so look out for that one. So that'll be it for today, and have a great day, and we'll see you on the next one.